Hello, I'm Tiffany Green, family nurse practitioner with Simply New You Weight Loss and Wellness. I am certified in medical weight loss management along with bioidentical hormone replacement therapy. So today I wanted to do some of the frequently asked questions that I often get about GLP-1 medications, which are the weight loss injectables. And so the first question is, what are they? So with GLP-1s, the way that they essentially work is that they help to slow down digestion within the GI tract. And so by slowing down digestion, food sits on the stomach just a little bit longer. This is how you feel fuller longer. Also, it helps to decrease cravings. It helps to regulate blood sugar, helps with decreasing insulin resistance. So these are all factors that are very important when it comes to weight loss. Another question is, are the medications safe? So these medications, I'll be honest, it just depends on who's prescribing them. So as long as you're with a provider who's knowledgeable, they're credentialed, they understand about GLP-1 medications and how to properly manage someone on them, then yes, the medication is safe. These medications are not new. They have been on the market for years, actually since 2005. And so this was originally used for diabetic patients, and they saw that one of the side effects was weight loss. And so this is why it is FDA approved. But once again, it just comes down to making sure that the practitioner is knowledgeable who is prescribing the medication for you and clearly understands weight loss and how the medications properly work. Also, too, the medications, we can increase someone on the medication like every 4 weeks at the lowest dose and just gradually increase every 4 weeks. But ideally, if someone is tolerating the medication well, they're doing great, they're not having any side effects, ideally we can keep the patient on that medication. You don't want to be in such a rush to quickly increase or start someone at the very highest dose. So this is going to come down to obviously the knowledge of the practitioner that's providing the medication. So those are ways to stay safe, is making sure that we're following the guidelines when we're prescribing the meds. Another question that I get is, can I take the medication long term? And so essentially, yes, the medications are safe to take for long term purposes if need be, but it also just depends on the patient and their situation. So if you have some patients who have been struggling with weight loss since childhood, who may need more help with making sure that they can maintain their weight loss, then it's perfectly safe, and we want to eventually, go back down to like the lowest dose and keep the person on maintenance that way if need be. But also too, I was on a medication myself. Once again, it's very patient specific. Some people are able to meet their goal weight depending on what the situation may have been. When I was needing help with being able to decrease and lose weight after having kids, because I was having such a difficult time doing it along with diet and exercise, once I got to my goal weight, I was able to maintain and not needing to be on it. So it just really is patient specific. There is no right or wrong way, just as long as we're being safe. And if you're needing to stay on it for longer periods, just mostly at the lower doses. And then sometimes you can also do like every other week. So that would just come down to a conversation that you would have with your provider when it comes to maintenance. The biggest thing with the medication though is that we don't want to rely just solely on the medication. It's still very important to implement a healthy lifestyle change with that though. So making sure that we are eating nutrient dense foods, we're getting physical education, physical activity and exercise while we're on the medication. So that's what's going to give you the actual sustainable long-lasting results. So the next question is, do you just gain weight right after you have come off the medication, or after you lose the weight, does it come right back? So kind of what I was saying before, this really depends on when it comes to your lifestyle changes. When we lose weight, it's not about just getting skinny. We want to burn fat, but we also want to maintain muscle mass. So this is the proper way of losing the weight. And this is how we're going to have more sustainable results, because when people like want to lose so quick, you're just losing muscle mass. The weight's going to come right back. And so therefore, yes, it can come back. But if you're doing it the correct way, we are doing weight resistance training along with the medication, because that's the biggest thing, as I stated, retaining muscle mass. So doing weight resistance training, retaining the muscle, burning the fat, making sure that you're eating properly, yes, you will have more sustainable results. But if you're going to someone and they're just giving a medication and you're not getting that proper guidance, or you're not seeing a personal trainer or going to a gym or getting some kind of physical activity or eating correctly, then unfortunately, you may not get the results that you're wanting, or they may not be long-term results. Another question, they all kind of go with each other. Do I need to diet and exercise? So yes, that's still very important. You really can't have like one without the other. So when we're doing the medical weight loss, usually this is a lot of times people have tried everything. They have tried dieting, they have tried nutrition, physical exercise, and so there's something like on a metabolic level that may be hindering someone from losing the weight. So sometimes, often, we might have like thyroid issues, it might be hormone issues, some patients, if they're going through menopause. So there's certain reasons why you might need the medication to help you on a metabolic level, and you're not able to maybe do it on your own and achieve the results you're wanting on your own. So it really takes like both together synergistically to achieve the effects that you want. You can't have one without the other. You can't just take the medication and not eating, exercise. And if you're having more of a health conditions that's hindering weight loss, sometimes it may not be possible to just do it alone without getting some type of medical treatment. So those two kind of go with each other. And then also the side effects. So when it comes down to the medication, yes, a lot of times you're going to get more like GI type of side effects with the medication. So like nausea, vomiting, constipation, diarrhea, gastric reflux. But once again, it comes down to making sure that whomever you're going to, they can help you through the side effects and trying to prevent them. Because often the times what happens is that people, they don't really want to eat. They kind of forget to eat, or they don't have that drive or desire anymore. And so you can become dehydrated, and the medication itself can already be dehydrating. So if you're not eating, you're not getting your protein, a lot of times that can cause some of that nausea, vomiting, just not feeling good. To another thing, secondly, is that if we are eating a lot of processed foods, heavy fatty foods on the medication, and as I said it before, the medication is working to slow down the digestion. So if food is just sitting on your stomach longer and you are just like eating really bad foods on the medication, then yes, a lot of times that can cause a lot of the GI irritation. So making sure that we're eating the proper foods, we're staying properly hydrated, you're getting your protein. There are ways to help try to alleviate these symptoms and for them not to become worse. The biggest thing is the minute you get some type of like side effect, making sure that your practitioner, they can follow up with you in a timely manner, and therefore help work you through some of the potential side effects that may occur. But there are ways to alleviate it, and there are ways to where there are so many people that tolerate the medication and do so well on it. It just comes down to the proper education and to the proper guidance. So those are really like the majority of the questions that I get asked all the time. Now, of course, if you have additional questions, please leave comments, get in contact with me. I would love to help you. Today I'm in my office, and so I decided just to go ahead and answer some of those questions, but I'm also here for you. You can get in contact with me, 832-535-8032. My website is simplynewYou.com. And so I'm always here too if you just want someone to further help guide you when it comes to weight loss management and on the medication. So please like, follow, share, and I hope you have a great day.